Saint Lucia, like many other countries in the region, has managed the safe reopening of many sectors while managing COVID-19 in country. Health and safety has always been the priority while working with the various sectors. Over the past year, the Ministry of Health and Wellness has been working closely with the Ministry of Education to coordinate the safe, sustainable reopening of schools. The school environment is not classified as one of high risk. The school administration, with the support of staff, can work together to ensure a safe environment is maintained. Children under 18 years of age represent 8.5% of cases in the US setting and less than 5% in the UK and EU settings for COVID-19. In Saint Lucia, children under 18 years make up to 9% of cases to date. Generally, this age group presents with mild or asymptomatic disease. There have been no deaths to COVID-19 in this age group in country. Current evidence suggests that children are less likely than adults to be transmitters of the disease, and child-to-child transmission is uncommon at schools. Schools have not been associated with significant increases in community transmission. Some of the considerations include the following: the continuity of education for the overall well-being, health and safety of children, the impact of school closures on educational loss, equity, general health and well-being of children, minimizing the risk of COVID-19 transmission within school and school-associated settings, reducing the risk of community spread from schools. In an effort to address these, the following have been recommended: the psychosocial support when needed to address fear and anxiety, medical support provided through the support of the community wellness centers, the availability of safe, effective vaccines to all staff of the educational sector, ensuring school-related measures are integrated and support measures implemented at the community level, the provision of accurate, updated information to staff and parents to counter misinformation, the training and sensitization of all staff members, and the management of stigma and discrimination at schools, the full usage of the education sector continuity plan at every school, which clearly highlights all of the protocols and algorithms in managing any issues at the various schools. We acknowledge and understand the concerns of all related to COVID-19, but we cannot act out of fear. We need to use the assessment of our local situation and ensure that the necessary measures are in place to move forward. Additional factors that are also considered include the harm that may occur due to school closure, the risk of the non-return to school by students, the widening disparity in educational attainment, limited access to meals, and the need to maintain schools at least partially open for children whose caregivers are essential workers. According to the World Health Organization, there have been few COVID-19 outbreaks in schools. From the studies conducted, the transmission was primarily related to social events related to schools rather than transmission within classrooms. The Ministry of Health and Wellness, through the use of scientific evidence-based data and using the epidemiological analysis on our national situation, will continue to work closely with the Ministry of Education as we prepare for the safe educational environment for all of our students, the staff and the management of these institutions.